Indigenous people here, we've always had science, we've always collected data, we've always shared information with each other. And a lot of the different ways we did that was through physical pieces and oral stories rather than, written on paper. I mean, we do have books now, but this wasn't how we used to share information. All of these stories were carried by elders, by leaders throughout history, and a lot of the stories that are in here are still carried by us.
Protective factors are aspects of life that help reduce risk. They provide safety and stability so when situations get difficult or stressful, we have healthy coping skills and adequate resources to navigate them. Colonization has systematically tried to wipe out every protective factor we have.
If we're not naming colonialism as a determinant of health, as well as the protective factors, the cultural protective factors, then health equity for Indigenous people is inconceivable.
Well, I think first and foremost, the fact that the recognition that there is data missing and that it's affecting our health and our well-being truly speaks to why this data justice movement is so important to ourselves and our community, our families, our children, our future generations. It's important that we know exactly what is going on in our communities, and it's my true belief that the termination efforts are still ongoing, and this data injustice is an example of that. Not having this accurate information is detrimental to our community's health.
In the past, the way data has been collected from our communities has really hurt tribal people. For instance, if we look at historically, our children were taken from families in tribal communities and put in boarding schools. During that time, there was no regard for data collection. There was no count of, how many of our students, of our young children went missing. And we don't know to this day. There are unmarked graves. There are families who are just left without answers. And that continues today.
When we look at the Indigenous people and the Native community, we can see multiple representations of different struggles we're going through. The red handprints, the orange shirts, the blue representations of our water, those are all telling stories about what our people are going through.
I just always go back to those words of kill the Indian, save the man, and looking at our people in a negative light has been something that has been ongoing in U.S. history. And it's been long overdue for that to change, and we need to be more empowering for our people because we are powerful people, we are resilient. The fact that I'm sitting here today is a testament to that.
Abigail Echohawk, Executive Director of the Urban Indian Health Institute, said, "One of the ways that there is a continuing genocide against American Indians and Alaska Natives is through data. When we are invisible in the data, we no longer exist." Data genocide includes the ongoing tactic of erasure by using colonial classifications to discriminate and dehumanize Indigenous peoples.
One of the ways that data genocide has impacted us today is missing and murdered Indigenous persons. For instance, states don't collect data on Indigenous persons who go missing, and that's several reasons. There's a mistrust of government or police systems. Historically, they have treated us badly, and so families sometimes don't report missing people.
I'm often called upon to partner with our medical examiner's office whenever they have someone in the community who has passed away. Most recent example is a Native houseless individual passed away at an encampment in Multnomah County. And they knew that this individual was a Native American person, but they didn't know how to get in touch with the family to notify them. And I think within our community, there's a lot of responsibilities and there's cultural practices that come into play, and making sure that you're taking care of somebody if they pass within a certain time frame and in a certain way. And if we're not able to identify who these folks are and have that trust built within communities, we're not able to get them home in a time that allows them to be able to take care of their family member in a culturally relevant and a culturally specific way that they need to. I think just going through that process of knowing that you need to be culturally sensitive when dealing with something like this because of that history when it comes to government in our Native communities. And so that's an example of a way that culturally specific work and data collection shows up in the work that I do.
Another area that is of concern where data is miscollected is around our Two-Spirit youth. Just recently, in fact, within the last year, our health systems have not collected gender identity. And again, just recently, Indian Health Service started screening for gender identity, and before we're not.
And I think the only thing that is challenging for Indigenous communities, especially urban Native communities who live within multiple governmental systems like Multnomah County and the city of Portland, multiple jurisdictions are involved. And then you have the state and federal level as well. And how data is collected there, we're never asked to engage in that process or to make sure that that process is reflective of a way of collecting information that truly sees us, and all of who we are, and all that we need as a community, and also all of the strengths that we bring.
Data sovereignty is our right as Indigenous people to determine what is important to collect, the process of collection, the analysis method, where and how to store it, the ownership of it, and dissemination of data for our communities in a way that advances our social prosperity while monitoring the stories that have been shared across generations.
So when we think about data justice and data sovereignty, these are practices and ideologies and ideas and tools that have really been led by populations who are historically and continue to be oppressed, who continue to experience racism and the lasting impacts of colonization within the systems like public health that are effectively designed to support us and take care of us, safeguard us, but are actually not well prepared to do that. We get to tell the stories of our people in the way that we really know ourselves and how beautiful we are and the contributions that we've made, not just to the field of public health, but to all people.
When I think about data sovereignty and I think about data collection and how we do that throughout systems that impact Indian people, I think about the fact that we really are becoming invisible when we're not doing that in a way that is reflective of Indigenous values and Indian people and our many, often multiple identities and how we show up in those spaces.
When we think about data sovereignty, this is different than data justice. It's part of data justice, but it takes the effort further that tribal nations, Indigenous entities, Indigenous serving entities, we drive that data gathering, how the data are collected, but we govern those data. How are those data used? How are the stories of those data told?
If a government is saying, I want to fund any particular service, but we're only going to collect certain information in a certain way, you're putting Indian people in a situation where they have to figure out how best to identify in that moment and which identities to leave behind when they're filling out an application for services, when they're entering into a system, whether they want to be there or not, to access something that is going to benefit their family, themselves, or their community. You're really putting them in a situation to leave behind much of who they are just so that they can gain access.
We need to be able to tell our own story because so many times researchers have come into our communities and stolen information and research without proper consent of our communities, and the story wasn't told accurately or the full picture wasn't given. And we need to be able to have the power to tell our own story in order to continue to heal from historical trauma and colonization.
Maria Yellowhorse Braveheart defines historical or intergenerational trauma as the collective, cumulative wounding across generations, creating community-wide trauma. The historical context of intergenerational trauma impacts how we interact with systems, institutions, governments, and each other.
I think you have to think about the level of trust and relationship that a local government agency has within the Native community, and how that historical context shows up in that space. You know, having a Multnomah County vehicle pull up to your home to notify your family, that logo, that registers differently for Native families.
Without good data, our communities really suffer. So many of us working in tribal communities or working in advocacy are really working toward keeping that data updated, keeping it, getting our data correct.
When a youth comes into contact, or really anybody who is suspected of committing a crime in community, they come into contact with law enforcement, and police officers often just do a visual identification of their race and identity and gender, and they document that on that police report, and that police report is often not corrected any along the way at all. When you have somebody that is convicted of a crime and goes into one of our jails that are managed by Multnomah County, one of our correctional facilities, we don't ask them how they identify. We don't ask them their tribal heritage. We don't ask them their tribal affiliations. None of that, and that's often where we're lost. And then we're using that data often to inform intervention and prevention services and funding that we push out into community through community-based organizations. And if that data is skewed, then we're using inequitable data.
The systems that we operate within and that control many aspects of our lives teach us implicit biases. Implicit bias is the unconscious judgments our minds make based on the things we have been told are true. That bias shows up in what data is collected, how it's collected, and for what purpose. It also includes how data is categorized and analyzed, which often leads to a misinterpretation of our identities or experiences.
And what happens a lot of times in the urban Native community especially is that our numbers are lost. So if somebody is mixed, if they're Afro-Indigenous, or if they are just mixed with other races and ethnicities, they get marked as other, and then they're not captured in the data that we have for Native American, American Indian, Alaska Native numbers. The way my grandma used to say it with us, she's like, well, either you're a Puyallup or you're not. There's no in between, and you can still be all of the other things that you are, and you're still Puyallup. So, and that goes for other tribes as well.
It makes me think of something that my mom used to talk about with me as well, and she would always say, lead with your Indianness. Always lead with the tribe in which you are enrolled, or always lead with the tribe in which you have the most connection to, because we have many identities as Indian people. I come from 3 different tribal affiliations, and I'm also French Canadian, and I think about that showing up in our community. We're often lost in the 2 or more races category. And if within our systems we're not correcting that information at any point along the way, you're continuing that harm, and then you're using that information to fund programs inequitably.
Like many in our community, the FGC has and continues to work on many projects to address historical inaccuracies in data.
We're doing a food sovereignty survey in our community because there isn't enough data in urban Native communities around food access and around food sovereignty, land access. And we want to be sure that the work we're doing is what is wanted and what's needed. And the only way to do that is to ask.
We have to keep working to stay ahead. We can't just sit back and relax.